Better move on, I think, to Francesca, who's come from Italy. She's at both School of Medicine and a small spin out.
Okay.
The floor is yours.
Okay. Thank you. Okay, good morning. I'm Francesca Re. I work in the research group of Professor Massimo Masserini at University of Milano Bicocca. And now I will present you some new results about the potential prevention of Alzheimer's disease by using multifunctional liposomes. Alzheimer's disease, as you know, is a progressive neurodegenerative disease that begins with a deficit in the short-term memory and culminates in the total loss of cognition and executive function. Now, Alzheimer's disease represents about the 70% of the all total dementia cases, and these numbers are expected to increase due to population aging. From the macroscopical point of view, the three main hallmarks of Alzheimer's disease are the brain atrophy, the cortical thinning, and the large ventricles, comparable to the healthy brain. And from microscopical point of view, the two main hallmarks are the presence of extracellular plaques and the intracellular aggregation of hyperphosphorylated tau protein. Among these two, the extracellular plaques is, and will be the main therapeutic target of Alzheimer's disease, and are mainly composed of a peptide that is usually called A-beta, beta-amyloid peptide, that derives from the proteolytic cleavage of the APP, is an amyloid precursor protein, by beta and gamma secretases. An imbalance between A-beta production and clearance could play a critical role in the pathogenesis of Alzheimer's disease. And among the different aggregation forms, oligomers seems to be the most toxic species in the brains. Currently, no cure is available for Alzheimer's disease, and the only drugs approved are, may help only to prevent some symptoms like depression, anxiety, wandering, agitation, sleepiness, and something like that. Then strategies targeting beta-amyloid are actively sought after, and the main problem, not only for the treatment of Alzheimer's disease, but in general for the central nervous system disease, is the presence of the blood-brain barrier, that, as you know, is a physical and biochemical barrier that separates the blood from the brain. And physiologically, the blood-brain barrier plays an important role in the protection of the brain tissue and in the controlling of the passage of substances from the blood to the brain and vice versa. But from the other side, the blood-brain barrier strongly limits the passage of therapeutic and also diagnostic probes from the blood to the brain from the therapeutic and diagnosis point of view. Nanomedicine could be help to solve this problem thanks to the design of multifunctional liposomes that simultaneously can target and cross the blood-brain barrier, reaching the brain, targeting, in this case, the beta-amyloid peptide, and carrying drugs and or together with imaging contrast agent. In our laboratory, we have developed and patented liposomes that are made by a phospholipid bilayer composed of sphingomyelin and cholesterol and are multifunctionalized with phosphatidic acid as a beta targeting ligand, and with a peptide, a modified peptide derived from the human apolipoprotein E to target and cross the blood-brain barrier. We have extensively characterized in vitro this type of nanoparticles, but for the reason of time, I cannot show you everything. But in summary, these type of nanoparticles have a size around 120 nanometers, are negatively charged, are biocompatible, are able to bind specifically the beta-amyloid peptide with high affinity in the nanomolar order range, are able to disaggregate a beta assembly and to slow down the aggregation of the beta-amyloid peptide, and in vitro are able to overcome, to target and cross the blood-brain barrier in using an in vitro transwell system. Also, in vivo, we have many data, but I would like to show you just the most important one. That is the biodistribution of this type of liposomes in vivo. We performed 2 different types of experiments. The first one is by using radiolabeled liposomes, and we measured the amount of radioactivity in the different body districts, and we found about less than 3% of radioactivity in the brain after peripheral administration. And in order to check if these liposomes are able to reach intact the brain, we prepared the same liposomes with 2 different fluorescent probes, one for labeling the lipid bilayer, and the other one the aqueous core. And we found the colocalization of these 2 fluorescent signals in the brain slices of mice treated with these liposomes. In vitro, as you can see here, these liposomes are able to destroy the typical reticular forms of a beta fibrils, and then are able to disaggregate the beta aggregates in vitro. Then, starting from this and from other promising features, we test the proof of concept in vivo by using an animal model of Alzheimer's disease. This animal model is widely used in the scientific community. It's a double transgenic mice that possess a mutation in the APP, the precursor protein of beta amyloid peptide, and presenilin-1, that is a component of the gamma secretases. This type of animal at 5 months of age, I don't know if you can see, display an initial brain beta deposition, these small white spots, but the absence of cognitive deficits that could be considered a model of a pre-symptomatic Alzheimer's disease. The same animal between 10 and 12 months of age display evident beta amyloid plaques and also evident cognitive deficit, and are usually considered as a model of severe Alzheimer's disease. We have already tested our liposomes in this condition. We have already published, and we have already shown at CLINAM 2 years ago. And just to summarize the results, we treat this type of animals at 10 months of age by intraperitoneal injection, and the treatment schedule was 3 injections per week for 3 weeks, then an acute treatment. And the results was very, very promising, because we find a restore memory impairment, a restore of the memory impairment, a reduced the brain plaques either in number and area, and also the reduced beta burden and the amount of oligomeric species. But the main concerns about this type of treatment is that is the translatability to humans. Is not translatable to humans, because if we imagine to treat a patient with Alzheimer's disease already in a severe condition, there is an irreversible brain damage. Then is it almost impossible to induce a neuroregeneration. It's too late. In fact, this is the main problem of the failure of almost all the clinical trials focused on moderate of Alzheimer's disease. Then the main problem, we think, that is not the target molecules, but is the therapeutic windows in which the treatment are started. Starting from this, our previous results, and from the failure of the clinical trials, and starting from the known that the accumulation of beta amyloid peptide in the brain begins 10, 20 years before the onset of the clinical detectable symptoms, probably this early stage is considered, or could be considered, the most promising time frame in which to start the therapy. Then we start the treatment with the same animal models, but at 5 months of age, in which there is only initial beta deposition and the absence of cognitive deficits. And the treatment is more or less the same. We change, of course, the time schedule, and we perform 1 injection per week for 7 months in order to reach the 12 months where the mice display Alzheimer-like pathology. At the end of treatment, the mice were analyzed for the memory impairment, for the cerebral abnormalities, from the brain beta content, and also from the content of beta amyloid peptide in the periphery. I don't know what is you're familiar with this memory test. I don't know if time to explain you. Anyway, we can discriminate by the memory test the memory performance of the healthy animals respect to the transgenic one by measuring the time that the animals spent around the new object because they remember the old one. Then we can assess like a memory, short-term memory of the mice. As you can see here, the preventive treatment with our liposome prevent the onset of the memory impairment because, as you can see here, before the treatment, the transgenic mice, the cognition is similar to healthy mice. Without treatment, there was a memory impairment. With our liposomes, the memory cognition was almost similar to healthy mice. The treatment also prevented the occurrence of AD-like cerebral abnormalities. As you can see here, the untreated might display a larger ventricles volumes with respect to the treated and healthy mice. We have detected also a strong reduction of brain beta deposition by immunohistochemistry, either in plaque area and total number of plaques. And we also measured the total brain beta burden, and we found a decrease either in insoluble but also in oligomeric species that I cannot show you here. And we found an increase in the beta amyloid peptide in the periphery, in particular in the liver and in the spleen. Then what is the mechanism of action that we have supposed? These liposomes are able to enter the brain by crossing the blood-brain barrier, where they disaggregate A beta assemblies, making A beta soluble species available for transport outside from the brain to the bloodstream. In the blood, the liposomes remain in the circulation, catch the beta amyloid peptide, bring it into the periphery for the degradation. This is the mechanism of action. If I have only 1 minute, I would like to give you the most interesting and also surprising things is that these effects were also maintained up to 3 months after the end of the treatment, because a group of animals was not analyzed, but analyzed 3 months after the end of treatment. And the results was maintained. But this is not compatible with the half-life of the liposomes, because liposomes usually, our liposomes, for the maximum circulation time is about 2 days, not more. Then what is the reason of this long-lasting effect? And we try to analyze the potential effect of this treatment on degradation system of a beta amyloid peptide. In particular, we measure the levels of active neprilysin and insulin-degrading enzymes that are the two proteases that are responsible of the proteolytic degradation of the beta amyloid peptide in the brain. And we found an increase in the level of both these proteases. And we also measure the levels of these two transporters, LRP1 and RAGE, that are usually responsible of the beta exchange between the blood and the brain. In particular, LRP1 is responsible for the beta efflux from the brain and RAGE of the beta influx into the brain. And we found an increase in LRP1 and decrease in RAGE. Then we developed, in conclusion, a nanomedicine that is able to act not on the A beta production, but on the A beta clearance systems. In fact, now the basis of Alzheimer's disease pathogenesis is changing not to the overproduction of beta amyloid, but on an impairment clearance system. And our nanomedicine is able to enhance the A beta clearance system, promoting either the cerebral proteolytic degradation, but also its efflux from the brain. This type of liposomes as well tolerate nanomedicine, because we have also a toxicological analysis of these liposomes, and could be potentially suitable for the prevention, in this case, of Alzheimer's disease. I would like to thank all the people that work at this project, in particular Simona Bancini that is here, and thank you for your attention, of course.
Thank you.
Thank you.
Thank you for a very provocative talk. Any questions? I'm sure there are. No? Okay.
Okay.
No, I'm sure there's some.
Sorry.
Really nice talk. Thanks a lot.
Thank you.
Do you know something about the mechanism, how you cross the blood-brain barrier?
Okay, we use a modified peptide of apolipoprotein E because LDL, that are low-density lipoproteins that are physiologically present in our blood, are able to cross the barrier by transcytosis, because the apolipoprotein E is recognized from the receptor presence at the level of the blood-brain barrier. And then we would like to exploit this physiological mechanism to cross the barrier. And we use only the sequence that is recognized from the receptor. And this sequence has been modified, attaching 3 amino acids more. And this peptide is also positively charged. That could be also by adsorptive transcytosis, the mechanism.
Thanks. And then you found 3% of what you injected in the brain?
Less than 3%.
And after how long did you measure that?
24 hours. This was the maximum.
Thanks.
Okay. One of the things I always wonder myself is that very familiar with PEG and its pros and cons. But one thing that PEG has, a very strong merit, is its ability to disaggregate things. I've often pondered a targeted PEG, how useful that might be in breaking up these plaques, really. I give it to you as a thought, really, I don't know. But I've not seen any research done along that line. Yeah.
Okay.
Okay. Well, there's no further questions. I call the session to a halt.
Okay.
And thank you for all the speakers. And I've given you 10 minutes to get to the other sessions, so I think you have plenty of time. We've taken a relaxed view over it this morning.